All right, so we're going to cover chapters 8 and 9 this week. I'm going to record 8 now, trying to I shortened it up a great deal from what the book is, and I'm going to record chapter 9 shortly. They will both be posted along with both homeworks to help you to prepare for the next test. Chapter 8 deals with the skeletal system, and I am going to give you a quick overview of the skeleton. I'm not really interested in you learning the exact location of all 206 bones in the body. I want you to be familiar with the regions, and there are two major regions to a skeleton. That is the axial skeleton, which is the supporting axis of the body, which basically becomes the skull, the vertebrae, the sternum, the ribs, the sacrum, and the hyoid bone. And then the appendicular skeleton, or the skeleton of our appendages, would be the girdles that hold the appendages in place, the pectoral girdle and the upper extremities, the pelvic girdle and the lower extremities. Now, there are some details of each of those that we're going to go into, but again, I want you to be familiar with the skeleton, not to think that you need to memorize the skeleton in an introductory anatomy course. So here we have the skeleton, the appendicular skeleton shaded in green, the axillary skeleton, or yeah, uh, in a more neutral tone. So again, there are about 206 bones in a typical adult skeleton. That number varies between individuals. There are some sesamoid bones that are different in individuals. There are sutural bones in the skulls that are different with different individuals. When we are born, we are closer to 270 bones at birth, but many of those bones are going to fuse together, such as we get in the hip bone, the ilium, the ischium, and the pubis. Bones contain a number of markings. There are ridges, spines, bumps, depressions, canals, pores, slits, cavities, articulate surfaces, and they are important sites of joint forming, muscle attachments, nerves, passageways, and blood vessel passageways. And when you study bone markings on an articulated skeleton, that indicates a skeleton that is tied together with wires and rods, as it would be typically in anatomical position. And the other option is disarticulated bones, where you have the individual bones in your surface features can be observed in a little more detail when they are disarticulated. And in the lab, in our in-person class, we have both articulated and disarticulated bones together. Skull bones, the first one, there are about 22 bones joined by sutures, which are immovable joints. These bones and their structure give us several cavities. The cranial cavity completely encloses the brain. The orbits enclose the eyes. The nasal cavity, the oral or buccal cavity. We also have middle and inner ear cavities, and the paranasal sinuses. Paranasal sinuses are named for the bones in which they occur. So we have frontal, sphenoid, ethmoid, and maxillary sinuses. These sinuses are air-filled cavities connected to the nasal cavity and lined by mucous membranes, and that lightens the skull. If that was solid bone, it would be much heavier. It also provides resonance chambers for the voice. The skull also has many foramina or foramen, which are holes. So your mother was right. We all have a lot of holes in our heads. Most of these holes are passageways for nerves and blood vessels. Here are the sinuses. The cranial bones would be one of the sets of bones that make up our skull, the cranial and facial. The cranial bones enclose the brain and compose the cranium, which is a brain case. There are membranes called meninges that separate the brain from the bones themselves. The dura mater is the thickest one. That is the outermost one. It goes against the cranium and attaches to it in some places. There's a very large hole coming from the cranial bones called the foramen magnum, where the brain and the spinal cord meet. That cranium consists of two major parts, the calvaria and the base. The calvaria is called the skull cap, while the base is referred to as the floor. So here we separate the cranial and the facial bones. The cranial bones have three paired depressions. The anterior cranial fossa holds the frontal lobe of the brain. The middle cranial fossa holds the temporal lobes of the brain, and the posterior cranial fossa contains the cerebellum. And they are shown here. There are 8 cranial bones. There's 1 frontal bone, 2 parietal, 2 temporal, 1 occipital, 1 sphenoid, and 1 ethmoid. Frontal bone forms the forehead, roof of the cranium. It has the coronal suture, posterior boundary of the frontal bone. The supraorbital margin is the ridge of bone deep underneath the eyebrow. The supraorbital foramen is a passageway for nerves, arteries, and veins, and in some people extends into the orbit and forms the supraorbital notch. The glabella is the smooth area above the root of the nose. Right and left parietal bones form most of the cranial roof and parts of its lateral walls. Each is bordered by 4 sutures: a sagittal suture, coronal suture, lambdoid suture, and squamous suture. The external features include the parietal foramen near the corner of the lambdoid and sagittal sutures, the superior and inferior temporal lines, which are the attachment sites for the temporalis muscle. The temporal bone forms the lateral walls and part of the floor of the cranial cavity, and it consists of 4 parts. The squamous part, encircled by the squamous suture, which contains a zygomatic process, which is part of the zygomatic arch. The mandibular fossa, which is a depression where the mandible articulates with the cranium. The second region would be the tympanic part. It's a ring of bone that borders the external acoustic meatus, which is typically referred to as the ear canal. There is also a styloid process in the tympanic part, which is a pointed spine for muscle attachment. I would caution you, though, that there are several different styloid processes throughout the skeletal system, but they all look basically the same. They get the name because they're shaped like a pen or stylus. The mastoid part is the posterior to the tympanic part. It has the mastoid process, which is a lump behind the earlobe filled with air sinuses. The mastoid notch is an attachment for the digastric muscle. The stylomastoid foramen is a passageway for the facial nerve, and the mastoid foramen is a passage for a small artery and vein. The teres part, seen in the cranial floor, looks like kind of like a little mountain range. It has middle and inner ear cavities. Its internal acoustic meatus is the opening for the nerve carrying signals for both hearing and balance. The carotid canal is an opening for the passage of the internal carotid artery, and the jugular foramen is an opening for the internal jugular vein. The occipital bone is going to form the rear and the base of the skull. Some of the important features here are, again, the foramen magnum. That is a large opening, and when the brain passes through the foramen magnum, we start to call it the spinal cord. The basilar part is a thick median plate, the anterior to the foramen magnum. The occipital condyles are knobs on either side of the foramen magnum that articulate with the first vertebrae of the vertebral column. The condylar canals are present behind the occipital condyles, and they allow the passage of a small vein. The hypoglossal canal transmits the hypoglossal nerve. The external occipital protuberance is an attachment for the nuchal ligament, and the superior and inferior nuchal lines are attachments for some of the neck muscles. The sphenoid bone has a median body, which projects greater and lesser wings. The greater wings form about half the middle cranial fossa and are perforated by several foramina. The lesser wings form the posterior margin of the anterior cranial fossa and ends with a sharp bony crest. Here we have optical canal for the optic nerve and the ophthalmic artery, the anterior clinoid processes, spines of the lesser wings near the optic foramen. Supraorbital fissure is a gash in the posterior wall of the orbit that allows passageway of nerves, and the sella tertia contains a pit, the hypophyseal fossa, where we find the pituitary gland. The sphenoid also has a foramen rotundum, which is an opening for the trigeminal nerve, the foramen ovale, which is an opening for the mandibular branch, a foramen spinosum, a foramen lacerum, posterior nasal apertures, which are openings to the nasal cavity, and the medial and lateral pterygoid plates, which are parallel plates, each with an inferior extension called the pterygoid process, and that serves in muscle attachment. And those are all shown here. And again, listening to me for about an hour and a half is not going to get you all the information you need. Dig into your book, use your lab exercises to get a lot of this information. The ethmoid bone is located between the eyes. It contributes to the medial wall of the orbit, the walls on the roof of the nasal cavity and the nasal septum, divided into three portions: the perpendicular plate, which contains the nasal fossae, the cribriform plate, which has the crystal gallae to protect projecting, and it's the site of attachment for dura mater. And it also contains the cribriform foramina, which is part of the olfactory system, where olfactory nerves come through. The ethmoid labyrinth, is a large mass on either side of the perpendicular plate. It has a maze of air spaces called ethmoidal cells, making up the ethmoidal sinus. On the lateral surface is the orbital plate, which forms a medial wall of our orbit. For the eyes, the medial surface of the labyrinth contains curled plates of bones, the superior, middle, nasal conchae. The inferior nasal conchae is a separate bone. And those conchae create turbulence in the flow of inhaled air, which increases contact with mucous membranes to help cleanse, humidify, and warm the air going in, as well as cool the air going out. The facial bones are in the front of the cranial cavity. They are going to support the orbital, nasal, and oral cavities. They're going to give shape to the face, provide attachment for muscles of facial expression and chewing or mastication. There are 14 bones in the face: 2 maxilla, palatine, zygomatic, lacrimal, inferior nasal conchae, and nasal bones. Those are paired. And then one of a vomer and one mandible. The maxillae form the upper jaw, and parts of the orbits meet each other at the median intramaxillary suture. They have alveolar processes, which are bony projections between the bases of the teeth. Alveoli are sockets that hold the teeth. Infraorbital foramen are openings just below the orbit that allow the passage of blood vessels. Inferior orbital fissure is a slit between the maxilla and other bones that allow passage of blood vessels and nerves. Horizontal plates called palatine processes form the bulk of the hard palate. When those don't fuse, we get what's known as cleft palate. Anterior portion of the palate is called the hard palate. The soft palate is the posterior to the hard palate. The incisive fossa are a median pit behind the incisors, which are the front teats, and that's a passageway for arteries and nerve. Incisive foramina open to this fossa. The palatine bones are L-shaped bones that divide the oral and nasal cavities from each other posteriorly. Each has a horizontal plate and a perpendicular plate. The horizontal plates form the posterior 1/3 of the hard palate, and each contains a greater palatine foramen for nerve passages. The perpendicular plates form the lateral walls of the orbits. Other facial bones would include the zygomatic bones, which form the angles of the cheekbones in each of the part of the orbital walls. They have the zygomatical facial foramen and the zygomatic arch. The lacrimal bones form part of the medial wall of each orbit, and within them is the lacrimal fossa, which houses the lacrimal sac, which can have the glands that produce tears for us. The nasal bones are rectangular bones that form the bridge of the nose. The inferior nasal conchae, the largest of the conchae in the nasal cavity. The vomer makes the inferior half of the nasal septum, and together with a perpendicular plate of the ethmoid supports the septal cartilage of the nasal septum. And here they are. The mandible is the strongest bone of the skull, the only one that moves freely. It supports the lower teeth, provides attachment for muscles of facial expression and mastication. It has a horizontal body, a vertical and oblique ramus. The ramus meets at an angle for the masseter muscle. The right and left portions unite in the center at what's known as the mental symphysis, ossifies in childhood. The mental protuberance is the median point of the chin. The inner surface of this area contains the mental spines, which are muscle attachment sites. The mental foramina allow the passage of nerves and vessels of the chin, and the alveolar processes are between the teeth. The Y-shaped ramus has the condylar process containing the mandibular condyli, which is the articulation for the temporal bone forming the temporomandibular joint, or TMJ. And we'll be talking more about that when we talk in Chapter 9 about articulations. The anterior branch is called the coronoid process. It's an attachment site for the temporalis muscle involved in chewing or mastication. The mandibular notch is between the two processes, and the mandibular foramen is an opening below the notch on the medial surface of the ramus, which allows passage of nerves and blood vessels supplying the lower teeth. There are 7 bones that are closely associated with the skull but not considered part of it. 3 of these, three on each side, are the bones of the middle ear, the malleus, the incus, and the stapes. The 7th one is the hyoid bone, which is a slender U-shaped bone between the chin and the larynx. It's known in trivia because it does not articulate with any other bone. It's the only bone in the skeleton that doesn't articulate with another bone. It's suspended from the styloid process of the skull by the stylohyoid muscles and the stylohyoid ligaments. Has a median body flanked by the greater and lesser horns, and it's often noted in your CSI shows, your crime shows, because the act of manual strangulation tends to fracture the hyoid bone, so that's one of the things they look for to see if someone was strangled. There are some differences between the skull of an infant child and an adult. In infants, we have fontanelles, which are spaces between unfused cranial bones where the fibrous membranes that bones are forming in are still there. That allows some shifting of bone during childbirth and growth of the brain. It helps with passage of the head through the pelvic outlet during childbirth. They would include the anterior, posterior, sphenoid, mastoid fontanelles. 2 fontanelles bones fused by age 6. The skull approaches adult size by 8 or 9 years of age. Below the skull, we have the vertebral column. It's a flexible chain of 33 vertebrae with fibrocartilaginous intervertebral discs between them. The discs account for about 1/4 of the spine's 71 centimeter length, and that's the average. The discs compress a bit during the day due to the pressure of the body weight. Their function is to support the skull and trunk and allow for their movement. It also protects the spinal cord, absorbs the stresses of movement, and provides attachment for limbs the thoracic cage, and postural muscles. Vertebrae are divided into 5 groups. There are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. There are also 5 sacral and 4 coccygeal vertebrae. There are some variations among among individuals, so they say that can be 1 in 20 people, which is a fairly high percentage. Generally, those are due to differences in the number of fused vertebrae in the sacral or coccygeal region. Bends in the or curves in the vertebral column are known as either kyphosis or lordosis. Kyphosis is a concave. Lordosis is in the anterior direction towards the back, and lordosis is concave but towards the front. Now, some of these are normal, and we'll also talk about some pathological examples of kyphosis and lordosis. After we begin to stand upright and walk, we develop a couple of curves, and when we are first born, we have 2 curves. Those that are present when we are born, the thoracic and pelvic, are called the primary curvatures. Those that develop as we begin to lift our head and walk are called the secondary curvatures. So these are the normal cervical lordosis, thoracic kyphosis, lumbar lordosis, and sacral kyphosis. Here is an infant with only the primary curvatures being there. The abnormal curvatures include scoliosis, which is off to the lateral. Hyperkyphosis is an extra curve to the back, and hyperlordosis is an extra curve to the front. Most vertebrae contain a body, a vertebral arch, and the body or the centrum is the weight-bearing portion. It is mostly spongy bone with red marrow covered with compact bone. Rough superior inferior surfaces will enhance the attachment of intervertebral discs. The vertebral arch is formed from the pedicle and the lamina. The body and the arch form an opening called the vertebral foramen, and the stacked foramen from the multiple vertebrae collectively form the vertebral canal, which is the passageway for the spinal cord. Here is a representative vertebrae, a typical vertebrae. The superior articulate processes project upward from one vertebrae to meet the inferior articulate processes from the one above it. Facets are flat articular surfaces covered with hyaline cartilage. The intervertebral foramen is the opening formed when 2 vertebrae are joined. It allows passage of the spinal nerves that connect with the spinal cord. Each foramen is formed by an inferior vertebral notch in the pedicle of the upper vertebrae and the superior vertebral notch in the pedicle of the lower vertebrae. Intervertebral discs are cartilaginous pads located between the bodies of adjacent vertebrae. They have a nucleus pulposa, which is the intergelatinous mass, and an annulus fibrosus, which is the outer ring of fibrocartilage. Again, they bind vertebrae together, support the weight of the body, and help absorb shock. A herniated disc is often called a ruptured disc or slip disc, and that will put painful pressure on spinal nerves or spinal cord, depending on where it is. Now, those are the general characteristics. Each region has some of its own unique features. In the cervical vertebrae, C1 through C7, C1 is also known as the atlas. It has no body. It has lateral masses and superior articulate facets. And it forms a joint with C2 called the atlantotaxial joint. Lateral masses connect to the anterior-posterior arches, contain anterior and posterior tubercles respectively. Second vertebrae is called C2, or the axis very commonly, and it allows a rotation of the head. It has a dens, or odontoid process, that projects superiorly and serves as a surrogate body for C1. It's held in place with a transverse ligament. So here is C1. Note there's no body. And here is C2, which has the dens that acts as the body for C1. We have a bifid spinous process in C2 to C6 that allows attachment of the nuchal ligament. All the cervical vertebrae have a transverse foramen in each short transverse process, and this allows for the vertebral artery and vertebral vein to come through. C7 also has the vertebrae prominens, which is a spinous process that's not bifid, and it's especially long, and that will become for you, some of you anyway, an important physical landmark when you are doing examinations. Thoracic vertebrae have spinous process that angles sharply downward. They have a larger body than the cervical, smaller than the lumbar. The body has a small, smooth, concave sites called costal facets where the ribs attach. T1 through T10 have a transverse costal facet on each transverse process for rib articulation, which is lacking on T11 and 12. The thoracic vertebrae are most like the general vertebrae that we just talked about. But they do have attachment sites for ribs that are different. In most cases, the rib inserts between two vertebrae, with each vertebrae providing half the articulate surface. Rib articulates with the inferior costal facet of the vertebrae above and the superior costal facet of the vertebrae below. Exceptions to that would include T1, T10, T11, and 12. They have complete costal facets on their bodies for their respective ribs. Lumbar vertebrae are thick, stout. They support most of the body weight. They are more blunt, squarish spinous processes. They have a superior articulate process that faces medially and a lumbar region that's resistant to twisting movements. The sacrum is a bony plate that forms in the posterior wall of the pelvic girdle. It is initially 5 separate sacral vertebrae in children, but they begin to fuse by age 16 and usually are completely fused by age 26. Some of the general features would be the auricular surface, which forms the sacroiliac joint, the superior articulate process, which articulates with L5, the alia, which pair of large wing-like extensions and lateral to the superior articulate process, and the sacral canal runs vertically through the sacrum, ends in an inferior opening called the sacral hiatus containing the spinal nerve roots. The anterior surface is smooth and concave. It has 4 transverse lines that indicate the regions of fusion. There are 4 pairs of anterior sacral foramina that allow passage of nerves and arteries to the pelvic nerve organs, and the sacral promontory is a ridge jutting from S1. The posterior surface is very rough. It has a median sacral crest, which is a fusion of spinous processes, a lateral sacral crest, which is a fusion of transverse processes, and the posterior sacral foramina, which are 4 pairs of openings for nerves to the gluteal region of the lower limbs and the lower limbs, Mike. The coccyx usually consists of 4, although sometimes 5, small vertebrae, CO 1 through 5, that fuse together into a singular triangular bone by the age of 20 to 30. It's colloquially called the tailbone, and it is truly the vestige of an ancestral tail. CO One has a pair of horns or cornula that serve as an attachment points for ligaments and bind the coccyx and sacrum. It can be fractured during a difficult childbirth or by a hard fall, particularly in, not recently, but I have heard of individuals in ATV accidents who tend to fracture their coccyx. Now we go back up and we got the thoracic cage, which is the thoracic vertebrae, the sternum, and the ribs. They have a broad base and a narrow apex. They have a costal margin, which is the inferior border formed by the arch of the lower ribs. The thoracic cage encloses and protects the lung and hearts, offers some protection to parts of the spleen, liver, and kidneys, provides an attachment for the pectoral girdle and the upper limbs, and it rhythmically expands by the action of respiratory muscles to draw air into the lungs. The sternum is a bony plate anterior to the heart, which is divided into three regions: the manubrium, the body, and the xiphoid process. The manubrium is the broad superior portion. It has the median suprasternal notch, more commonly referred to as a jugular notch, and the clavicle notches for articulation with the clavicle bones. The body is the longest part of the sternum. It joins the manubrium at the sternal angle. And then if you've taken CPR, I'm sure you've heard of the xiphoid process, which is the pointed inferior end, again, an anatomical landmark used when you are administering CPR. But in reality, it's an attachment site for abdominal muscles. There are 12 pairs of ribs. Each is attached in the proximal end to the vertebral column, and most are attached in the anterior end to the sternum. If the anterior attachment is through a strip of cartilage, that cartilage is called costal cartilage. Each rib features a head, a tubercle, and a shaft. They're categorized as either true or false ribs depending on how they are attached to the sternum. The true ribs, the vertebral sternal ribs, 1 through 7, each rib has its own costal cartilage connecting it to the sternum. The false ribs, 8 through 12, each lack an independent cartilaginous connection to the sternum. 8 through 10 have a group of cartilages that merge called the vertebrochondral ribs, so they are just false ribs. 11 and 12 don't connect to the sternum at all, so they are referred to as floating ribs or vertebral ribs. The pectoral girdle, the shoulder girdle, supports the arm and links it to the axial skeleton. There are two bones on each side of the body, the clavicle and the scapula. The clavicles articulate medially to the sternum to form the sternoclavicular joint, laterally to form the acromioclavicle joint. Scapula articulates with the humerus at the glenohumeral joint, and this joint is easily dislocated, but I'll save most of that discussion for Chapter 9. Clavicle is an S-shaped, somewhat flattened bone. It braces the shoulder, keeps the arm away from the midline. Has a sternal end, an acromial end, and a coronoid tubercle. And it is, again, a frequently fractured bone. There is a difference between the left clavicle and the right clavicle. They are mirror images of each other. The scapula is a triangular plate-like bone that's posterior over ribs 2 through 7. It has 3 sides, a superior, a medial, and a lateral. The medial is on the vertebral side, the lateral is on the axillary side. There are 3 angles associated with it, again, superior, inferior, and lateral. The suprascapular notch in the superior border is for nerve passages. There is a spine, which is a transverse ridge on the posterior surface used for muscle attachment. And there are several fossa that serve as attachment sites: the supraspinous fossa, the infraspinous process, and the subscapular fossa. The lateral angle has three main features. An acromonium, the plate-like extension on the spine that forms the apex of the shoulder, articulates with the clavicle, forming the sole point of attachment of the scapula and the upper limb to the rest of the skeleton. The coracoid process, shaped like a bent finger, provides an attachment for tendons of the bicep brachii and other arm muscles. And the glenoid cavity is a shallow socket that articulates with the head of the humerus. It forms the glenohumeral joint. In the upper limb, we have 30 bones distributed into three segments: the arm, the forearm, and the hand. The arm is the brachial or brachium, extends from the shoulder to the elbow, and it only has one bone, the humerus. The forearm, the antebrachial region or antebrachium, goes from the elbow to the wrist. It contains two bones, the radius and the ulna. And the hand is divided into three regions: a carpal region, a metacarpal region, and the digits. The carpal region is the wrist. The metacarpal region are the bones in our palm, and the digits are the fingers and thumb. Humerus has a head, an anatomical neck, a greater and lesser tubercles, the intratrabecular sulcus, and a surgical neck, as well as the deltoid tuberosity. It is called the surgical neck because it is one of the most common places that gets broken. The humerus on the distal end has a capitulum, trochlea, a lateral and medial epicondyles, lateral and medial supracondylar ridges, the olecranon fossa, coronoid fossa, and a radial fossa. The radius is a bone of the forearm. It features a head at its proximal end, as well as a neck and a radial tuberosity. At its distal end, we have a styloid process. Remember, I told you those will come up more than once. They all have a similar structure, and they all are important for attachment of the muscles. An ulnar notch. The ulna on the proximal end has a trochlear notch, which is a C-shaped depression that articulates with the trochlea of the humerus. Olecranon, coronoid, and radial notch. The distal end has a bony point, also referred to as a styloid process. Interosseous membrane is going to attach the radius to the ulna, and the interosseous margin is found on each of those bones. There are 8 carpal bones in the wrist. They allow flexion, extension, abduction, and adduction. They're arranged in 2 rows. The proximal row contains the scaphoid, lunate, triquetrum, and pisiform. And the distal row contains the trapezium, trapezoid, capitate, and hamate bones. The hand has the metacarpal bones. They are the bones of the palm. Metacarpal 1 is on the thumb side. Metacarpal 5 goes on the little finger side. Each has a proximal base and a shaft called the body, and distal heads. The heads are going to form the knuckles when you clench your fist. The phalanges or phalanx are bones of the fingers. There are 2 phalanges in the thumb and 3 in each of the other digits. In the other digits, they are the proximal, middle, and distal phalanges. The thumb only has a proximal and distal phalange, as shown here. The pelvic girdle is a complete ring of bones composed of 3 bones. They are the 2 hip bones are coxal bones, also known as the ossa coxae. The pelvis is a bowl-shaped structure with bones and ligaments and muscles that line the pelvic cavity and form its floor. Anterior and posterior articulations and posterior. We have an auricular surface on each hip bone that joins the vertebral column at the sacroiliac joint. Anteriorly, the two hip bones are joined by a fibrocartilage pad called the interpubic disc, which forms a joint known as the pubic symphysis, as shown here. There are two spaces formed by the pelvis, the greater and lesser, or true and false pelvis, or false and true pelvis, sorry. There's a flare between the hips is the greater, the narrower, then inferior to the greater is the lesser. The pelvic brim is a round margin that separates the greater pelvis and the lesser pelvis. The pelvic inlet is an opening that's circumscribed by a brim that infant's head has to pass through during childbirth, and the pelvic outlet is the lower margin of the lesser pelvis. Each hip bone has three distinct landmarks: the iliac crest, the acetabulum, and the obturator foramen. And each adult hip bone is formed because three bones fused during childhood: the ilium, the ischium, and the pubis. The ilium is the largest portion of the hip bone. It extends from the iliac crest to the center of the acetabulum. The anterior and posterior superior spines, the anterior and posterior inferior spines. The greater sciatic notch allows passage of the sciatic nerve. The iliac fossa is an attachment site for the iliacus muscle. And in the ischium, we have the heavy prominent spine, the lesser sciatic notch, the ischial tuberosity, and the ramus, another term that's come up again and again. The pubic bone is the most anterior portion of the hip bone. It's composed of superior and inferior ramus and has a triangular body meeting at the pubic symphysis. Here is one on each side. This is a difference between the male and female. If you look at that sciatic arch and the width of the pubic symphysis. And then a more telling, generally, if you have an articulated pelvis, is the angle of the subpubic arch. In the lower limb, we have the thigh, the leg, and the foot. So the femoral region, the crural region, and the foot has three regions: tarsal, metatarsal, and toes. Femur is the longest, strongest bone of the body. It features at the proximal end, a head, a fovea capitis, a neck, a greater and lesser trochanter, intertrochanteric crest, intertrochanteric line, and a pectineal line and gluteal tuberosity. At the distal end, we have the medial and lateral supracondyle lines, and the medial and lateral epicondyles, the medial and lateral condyles, and the intercondylar fossa. The patella surface is a smooth surface from which the patella bone, the kneecap, articulates with, and the popliteal surface is a depressed area on the posterior surface. The patella is a triangular sesamoid bone embedded in the tendon of the knee. It's cartilaginous at birth, and it has ossified by ages 3 to 6 years. It has a base, an apex, and articular facets. Tibia is the thick medial bone. It's the only weight-bearing bone in the lower leg. It has medial lateral condyles, intercondyle eminence, tibial tuberosity, anterior border, and medial malleus. The fibula is not a weight-bearing bone. It is a slender lateral strut that helps stabilize the ankle. It has a head, a lateral malleus, and an interosseous membrane holds it to the tibia. There are 7 tarsal bones forming the ankle. They are a little different from the carpal bones because they do have a load-bearing role. Calcaneus is the largest tarsal bone forming the heel. The calcaneal, or Achilles tendon attaches to the distal portion. The talus is the second largest and most superior of the tarsal bones. It articulates with the tibia at the superior trochlear surface and sits in the calcaneus, articulates with the navicular. The proximal roll of tarsal bones include the talus, the calcaneus, and the navicular, while the distal roll are the medial, intermediate, lateral, cuneiforms, and a cuboid bone. The metatarsals are very similar to the metacarpals of the hand. Metatarsal 1, proximal to the great toe, metatarsal 5 toward the little toe, and the phalanges are the same as the bones of the fingers. They are 2 for the great toe and 3 in the others. Again, proximal, middle, and distal in the most of the toes. The great toe, like the thumb, are proximal and distal only. Sole of the foot is not flat on the ground. There are 3 arches to absorb stress. The arches are held together by short, strong ligaments. The pes planus, or flat feet, caused by excessive weight, repetitious stress, or a congenital weakness. The arches of the foot are the medial longitudinal arch, which goes from the heel to the great toe, the lateral longitudinal arch, which also goes from the heel to the little toe, and the transverse arch, which goes across the middle of the foot. Much better shown as a diagram than me trying to explain it. All right, that covers the bones. Stand by for one from the joints.